Hi, this is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about cancer of the cervix. Cervical cancer is a cancer of the female reproductive system that originates in the cervix. It's one of the most common cancers in women, and it's usually the result of the infections by the human papillomavirus, or HPV. It has also played a huge role in the scientific research, and thanks to the cervical cancer cells from the woman called Henrietta Lacks, which were the first human cells to be grown in laboratory and which continued to be used to this day in the labs in the world. The cervix is also called the neck of the uterus, and it protrudes into the vagina. The interior cavity of the cervix is called the cervical canal, and it can be divided into two sections. The endocervix is closer to the uterus, not visible to the naked eye, and it's lined by columnar epithelium cells that produce the mucus. The echocervix is continuous with the vagina, and it's lined by the mature squamous epithelial cells. The squamous epithelium of the echocervix of the columnar epitheliums of the endocervix meet. There is a line called the squamo-columnar junction, and right where the two types of the cells meet, there is the transformation zone, which is where the subcolumnar reserve cells multiply and transforms into immature squamous epitheliums through the process called metaplasia. Normally, mature cells are stuck in the G1, or growth 1 phase of the cell cycle, which is when cell grows and take care of regular cells' business like synthesizing proteins and producing energy. Eventually, whenever new cells are needed, they'll exit G1 and keep going through the rest of the cell cycle to eventually divide it into new identical daughter cells. Sometimes, the cells can be pushed out of the G1 and go through the cell's reproduction cycles faster than the body needs a new cell. This uncontrolled growth and multiplication is called dysplasia, and it's exactly how cervical cancer develops from the precancerous cells. Dysplasia in the epithelial layers of the cervix, also called the cervical interepithelial neoplasia or squamous epithelial lesions, usually starts in the basal layer of the transformation zone, typically the immature squamous epithelium there. In most cases, cervical intraepithelial neoplasia is called an HPV infection. There are over 100 different types of HPV, but only about 15 of them have been linked with cervical cancers. Specifically, HPV-16 is responsible for more than half of all cervical cancers. The virus is like a house guest that overstays their welcome and starts using the kitchen to make all their favorite foods. It inserts itself into the immature squamous cells of the transformation zone and then integrates into the DNA into the host DNA. Using the host DNA, HPV makes the huge amounts of two of its proteins, which is the E6 and E7. These proteins are responsible for pushing mature squamous cells through the cell replication cycles by blocking the actions of the tumor suppression genes like P53. The end result is uncontrolled replications of cervical epithelial cells which are resistant to apoptosis or normal programmed cell death. Now, you might see a couple of different ways to describing the stages of cervical intraepithelial neoplasia, but the most common is based on how much of the epithelium is involved. Grade 1 cervical intraepithelial neoplasia affects the lower 1/3 of the epithelium thickness wise. Grade 2 affects 2/3. Grade 3 affects almost all of the epithelium. And finally, carcinoma in situ affects the entire thickness of the epithelium. The higher the grade, the more likely the dysplasia will evolve into cancer. Eventually, carcinoma in situ can progress to invasive cervical cell, which is when cancerous cells break through the epithelial basement membrane and into the cervical stroma. Then it can spread to the neighboring tissues like epithelial layers of the uterus and of the vagina. Finally, it can pass through the pelvic wall and affect the bladder and the rectum. Lastly, it can spread by the lymphatics and circulatory systems to other areas of the bodies like livers and lungs. because HPV tends to invade squamous cells first. The majority of cervical cancers cases are squamous cell carcinoma. The second most common type also associated with HPV is a cervical adenocarcinoma, which involves the epithelial gland cells of the cervix. But either way, the progressions of the HPV infections to the cervical intraepithelial neoplasia to the cancer cell is generally slow. And it can take between 10 and 20 years before invasive cervical cancer cells develops. Okay? Now, since HPV is sexually transmitted infections, the risk of developing cervical cancer is high in females who do not use condoms and have multiple sexual partners. Not every HPV infections result in the cervical cancers, though. In fact, the immune system fights off most of the HIV infections, so let's believe that there are other factors involved. For example, the risk increases depending on the type of the HPV, how long the infections last, and if the person is immunocompromised. Environmental factors like smoking also increases the risk. But the good news is that vaccinations against HPVs immunize against several HPV types linked with cervical cancers, including HPV-16. The first symptoms of the cervical cancer is often abnormal vaginal bleeding, especially after sexual intercourse. Other symptoms include vaginal discomfort, vaginal discharge with unpleasant smell, and pain when urinating. If the cancer has spread beyond the pelvic wall, it can cause symptoms like constipations and bloody urine. Screening for cervical intraepithelial neoplasia and cervical cancer is done with the pap smear with high-risk HPV testing. Pap tests are so good at detecting precancerous cells that screening recommends a pap smear every 3 years for females between 21 and 60 years of age. Together with the HPV vaccine, these contribute significantly to the drop in case of cervical cancers worldwide. Now, during a pap test, some cells from the transformation zones are collected with a brush, and then they're examined under a microscope for dysplasia. If the pap test comes back positive for dysplasia, it may be followed up with a colposcopy. When it's a magnifying device called the colposcope is used to get zoomed in view of the cervix and then obtain biopsies. Treatment options for cervical intraepithelial neoplasia include cryosurgery, where liquid nitrous oxide is used to freeze and kill abnormal cells, and colonizations, where the transformation zone and some of all of the endocervix is removed surgically. Conizations can be done with a scalpel called knife conizations. Laser, or by heating a loop of thin wire with electricity, called loop electrosurgical excisions procedure. A large loop excisions of the transformation zone. Treatment of early cervical cancer is to surgically remove either just the tumor or also the uterus and associated lymph nodes. If the cancer is more advanced, radiation and chemotherapy may be done. Alright, as a quick recap, a cervical cancer is a cancer of the female reproductive systems affecting the cervix. It's most often squamous cell carcinoma caused by human papillomavirus infection. It starts at the cervical intraepithelial neoplasia and develops very slowly. Many cases of cervical cancer can now be prevented thanks to the HPV vaccine, or caught very early on by screening for precancerous lesions with the pap test. Precancerous lesions can be managed with the cryosurgery or conations, where treatment for cervical cancers is surgical.